The pathophysiology is very simple. Uric acid buildup causes pain and inflammation in the joints, which causes destruction inside the joints and can eventually lead to arthritis, that loss of protective cartilage in the joints, resulting in bone-on-bone pain. So for signs and symptoms, big toes are most susceptible to gout, but the pain and inflammation can also affect joints of the ankles, knees, wrist, and elbows. And even the skin becomes red due to the pain and inflammation. So Kaplan mentions, a client experiences acute bout of gouty arthritis. The nurse expects the client's affected foot to have which appearance? Red. Yes, because it's inflamed and in pain. Now I know this question says gouty arthritis, but just look at the key term there, gout. Now for causes and risk factors, some people have a genetic predisposition to the overproduction of uric acid, which builds up in the joints, causing pain and inflammation. But really the most tested direct cause is, write this down, high purine foods. Big test tip right there. So meats, alcohol, and seafood. Meats like chicken, steak, and liver. Alcohol like wine, beer, and liquor. As well as seafood like crabs, lobster, and shrimp. Basically think anything that is non-vegetarian. So just think of the double P's here. Purines cause pain and inflammation. Now other causes that can trigger a gout flare-up include being overweight, being diabetic, as well as physical stress, such as hospitalization, illness, or surgery. And even dehydration, as the blood becomes more concentrated and purines build up inside the body. Now for diagnostics, labs are critical. So serum uric acid levels are taken and will be elevated in clients with an acute gout flare-up. Hesse mentions pain and swelling of the right great toe. Which test will the nurse expect the primary care provider to order? Serum uric acid levels. Yes, so write that down. Pain and swelling, right great toe, huge indication of a gout flare-up. Now in terms of treatments, the big goal here is to prevent the gout. So big NCLEX tips to write down. Lose weight or achieve a healthy weight. Avoid the high purine foods to avoid the high pain. So no meats, alcohol, or seafood. Just go vegetarian. And a big one here, increase fluid intake. Highly tested there. We do this to flush out that uric acid buildup inside the body and into the potty. And we also monitor fluid intake and output, just to ensure adequate fluid balance. So Hesse mentions, which interventions should the nurse implement for a patient with gout? Select all that apply. Increase the patient's fluid intake, document the patient's fluid intake and output, and observe for medication side effects. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guide. And also feel free to share the love. Share with the class. Muscular dystrophy is the next topic. This is a genetic disorder that causes muscle weakness due to the replacement of muscle fibers with connective tissue. Technically, it's due to the change of DNA sequencing, resulting in a low production of the protein dystrophin, which is needed for muscle stabilization. Now, this condition mostly affects boys between the ages of 2 and 5 years old. MD is a progressive disease, meaning there is more and more muscle weakness that begins in the lower extremities, and over time, more and more muscle cells die, turning into fat and scarred tissues. So muscles can appear big and strong, but in reality, they're weak and frail. Now for the memory trick. MD for muscular dystrophy, think MD, muscular damage and weakness. Now there are 9 types of muscular dystrophy, but really the most tested is Duchenne's, which is the most common, and Becker, which progresses much slower than Duchenne's. So Hesse mentions, how is Becker's muscular dystrophy different than Duchenne's muscular dystrophy? It progresses much slower and its age of onset is over 7 years. And question 2, Duchenne's muscular dystrophy, DMD, Muscle weakness usually begins around the age of 3 years of age. Now for the signs and symptoms, this is what you should write down. 4 big NCLEX tips. And trust me, they love to show up on Select All That Apply questions. So number 1, the child walks on their tippy toes due to their Achilles tendon tightening up. Number 2 is disproportionately large calves due to walking on the tippy toes. And number 3 is frequently trips and falls. And number 4, which is probably the biggest sign here, the child places their hands on the thighs to stand up, known as the Gower's sign. Now this was huge on the NCLEX, so know those key terms. Hands on the thighs or the knees to stand straight up. Very slow in getting up. So pause the screen and look at this sequence here and write down these top 4 NCLEX tips. Okay, now for some patho tips for your pathophysiology exams. So as you know, you'll see muscle weakness or motor weakness, right? But you'll also see a waddling gait, and a big key term here is difficulty climbing stairs. So please be sure to write that one down. And Gower's maneuver, or Gower's sign, as mentioned before. We also see kyphoscoliosis, which is an abnormal curvature of the spine. So kyphoscoliosis is usually where the spine goes side to side. Next, we're going to see respiratory infections from muscle damage and weakness. So just think, the diaphragm muscle can be affected, which helps the body breathe. So less breathing or less deep inhalations, we're going to see respiratory infections. And lastly, cardiomyopathy in certain cases, the abnormal development of the heart, which we cover in a separate video. Now switching gears to interventions. There's no cure for MD, so children and adolescents are typically wheelchair bound, and most clients unfortunately die due to respiratory failure in their 20s or 30s. So for education, we want to remove throw rugs. Huge NCLEX tip. This is done to prevent falls and injuries. Number 2 is a diet that is high in fluids and high in fiber. This is done to prevent constipation due to the immobility. Now don't let the NCLEX trick you here. Iron deficiency and vitamin D deficiency is not related to MD. Now number 3 is gentle exercise, like swimming, yoga, and even walking. Not weightlifting here, as this can increase the risk of muscle injury. Now for pharmacology, we give steroids ending in zone, like prednisone. So remember, zones help to decrease the swelling, like with prednisone. Now don't let the NCLEX trick you here. We do not give muscle relaxants like baclofen. That's more for muscle spasticity or muscle spasms, which is not present in MD. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and Now for osteoporosis. The pathophysiology is very simple. Just think fragile, porous bones for osteoporosis. We find big holes inside the bone, kind of like Swiss cheese. This loss of bone mass results in low bone density and very brittle